Urologist reveals, can a penis ring boost your erection strength and stamina? Essential tips for older adults. You ever reach over in the middle of the night hoping to feel that old spark again, but your body has other plans? It doesn't respond the way it used to. And in that moment, under those quiet covers, you wonder, is this just part of aging, or is something actually wrong with me? If that's ever crossed your mind, let me be the first to say it out loud. You're not alone, and you're definitely not broken. I'm Dr. Jonathan Prescott, urologist, men's health specialist, and for over 3 decades now, a kind of unofficial confidant to men just like you. I've had hundreds of conversations in quiet exam rooms with good men who feel like they're losing a part of themselves. Men who still have the desire, still love their partner deeply, but something's not clicking below the belt, and they're too embarrassed to talk about it. Now, the first instinct, most men reach for the little blue pill. And don't get me wrong, it works for some. But others, it brings headaches, a red face, a pounding heart, and a pile of side effects nobody warned them about. And honestly, some of my patients just look me in the eye and say, "Doc, I don't want to feel like a science experiment just to be intimate with my wife." That's when I bring up something unexpected. Not a prescription, not a surgery, just a small ring, soft silicone, no batteries, no chemicals. And every time I see that eyebrow raise, I smile and say, no, it's not a gimmick. It's a real tool, and it might just change your life. Today, I want to walk you through exactly what that tool is, a penis ring, and why it's helped thousands of men over 60 reclaim their confidence, their closeness, and frankly, their dignity. No shame, no pressure, just knowledge. And at the end, I'll introduce you to one of my patients, a 67-year-old man who was ready to give up on intimacy entirely until one small change opened a door he thought was shut for good. So take a breath, grab a cup of tea. We're about to have a conversation most men never get to hear, but absolutely deserve. What is a penis ring really? So, what is a penis ring really? Let's be honest, the name alone makes a lot of men either chuckle or cringe. Maybe you've seen one online, hanging near the pharmacy counter next to the razors and back pain patches. You glance at it, then look away like it's some forbidden gadget from a James Bond movie. But here's the thing, it's not a joke, and it's definitely not something to be ashamed of. Let me tell you a story. A man I'll call Tomas, 72, sat across from me not long ago. A retired mechanic, still had grease in his knuckles, married 45 years. He said, "Doc, I still want her, I still love her, but my body, it's not showing up to the party." Pills gave him headaches. The idea of injections? Nope. Surgery? Out of the question, he told me. That's when I introduced him to something simple, a ring. Not a toy, not a magic trick, a medical-grade device, soft, flexible silicone, worn at the base of the penis just during intimacy. Think of it like a gentle support system, like an assist. You're not wearing it under your jeans or walking around the grocery store with it on. You use it when you're intimate. That's it. The goal? To help keep the blood where it needs to be, longer. For many men, the problem isn't getting aroused, it's staying that way. The mind is willing, the heart's in it, but the body fades too fast, and that can feel heartbreaking. The ring applies light, targeted pressure to the base of the penis, just enough to help trap blood inside, keeping the erection firmer and longer lasting. It's not cheating, it's not desperate. Heck, it's no different than using reading glasses because the newspaper print is too small. In fact, it's kinda brilliant. A small tool to support the very thing your body still wants to do, just with a little backup. And here's the truth I wish more men knew. You don't have to pretend this stuff doesn't matter. Intimacy after 60 isn't less important, it's more meaningful. It's not about performance, it's about connection, reassurance, that quiet look across the bed that says, I'm still here, we're still us. And for some men, that little ring becomes the bridge between frustration and fulfillment. Still unsure? Stick with me. Up next, I'll break down exactly how it works inside your body and why it's helped so many of my patients feel alive again. You might be surprised what a little science and a lot of heart can do. How does it work? The science behind the ring. All right, time to get under the hood a bit. Let's talk science. I promise, no medical jargon storms ahead, just the truth, plain and simple. Imagine this, you're 35 again, you feel desire, you get aroused, and boom, everything works like it should. Why? Because your blood vessels, both the arteries that bring blood in and the veins that hold it there, are in perfect harmony. It's like a symphony down there. But here's the reality. As we age, that balance starts to wobble. The arteries, they stiffen. Years of high blood pressure, maybe diabetes, even old smoking habits, they take their toll. But the big culprit, the veins, they lose tone. They get lazy. What does that mean for you? You get aroused, blood flows in, but then it leaks right back out. Like trying to inflate a balloon with a slow leak in it, frustrating and frankly unfair. In the medical world, we call this venous leak, and it's one of the top reasons I see older men struggling to maintain erections. The penis ring? It steps in as a pressure valve. Worn snugly at the base, not too tight, mind you, it gently compresses the veins, slowing down the blood from leaving. It's not creating the erection. That part's still up to you and your partner. But it helps hold the erection in place, like putting up scaffolding so the structure doesn't collapse halfway through the job. Let me tell you about George. He's 71, widowed, found love again, and excitement too. But every time things got intimate, he said, it just slipped away. She's kind, but I feel like I'm failing. When I explained venous leak, he sat back and said, so it's not just in my head? No, George, I told him, it's in your veins, and we can work with that. We tried a penis ring, along with a simple vacuum device to help get things started. 3 weeks later, he came back smiling. Not just because it worked, but because he felt something he hadn't felt in years, hope. And that's the power of understanding what's actually happening. Not blaming yourself, not retreating into silence, just knowing what your body needs and giving it a little intelligent help. Look, a penis ring doesn't fix the underlying issue, just like reading glasses don't cure your eyes, but it manages the moment. And for many men, that's the difference between giving up and reconnecting. Up next, I'll show you exactly who should consider trying a ring and, just as important, who shouldn't. Because while this tool has helped countless men, it's not for everyone. And knowing where you fall can make all the difference. Who should and shouldn't use a penis ring? Let's talk truthfully now. Just because something can help doesn't mean it should help you. And when it comes to penis rings, knowing whether you're a good candidate could be the difference between a private win or a painful mistake. Let me start with Frank. Frank is 68, retired high school teacher. Sharp as a tack, charming as ever. But lately, things below the belt weren't cooperating. He'd tried the ED pills, and they hit him like a truck, pounding headache, red face, racing heart. He came into my office saying, "Doc, am I just done?" I checked him out. No major nerve issues, healthy circulation, not on blood thinners. And I told him, "Frank, you not done. You're just using the wrong tool." For men like Frank, those who can still get an erection but struggle to keep it, especially due to venous leak, a penis ring can be exactly the kind of simple, drug-free support they've been looking for. I also recommend it for men with performance anxiety. Sometimes it's not the body that quits, it's the mind that talks you out of it halfway through. The pressure builds, the confidence dips, and everything collapses like a house of cards. In those cases, the ring becomes a kind of psychological safety net, like training wheels for your sex life. And guess what? Once that confidence returns, many of those men don't even need it anymore. And then there are the men who just want to boost things. Maybe you're not dealing with ED, but you'd like firmer erections or longer intimacy. There's nothing wrong with wanting to feel more in control, more alive, more connected. But let's be crystal clear now. There are real situations where a penis ring is not safe, and I'd be failing you if I didn't say so. If you have reduced sensation in your groin from diabetes, spinal injuries, or nerve damage, you might not feel if the ring's too tight. And that can lead to tissue damage without you even realizing it. If you're on blood thinners, even a little pressure can cause internal bruising or bleeding that takes days to settle. Always, and I mean always, check with your doctor first. If you've ever had priapism, that's a prolonged, painful erection that doesn't go away. A penis ring could trigger another episode, and that's a fast track to the ER. Lastly, if you tend to fall asleep quickly after intimacy, especially with alcohol or sedatives in the mix, that's risky. These rings need to come off within 30 minutes max. Forgetting it can do more damage than most men realize. So be honest with yourself. Are you someone who listens to your body, who follows instructions, who respects the tools he uses? If so, you might be an ideal candidate. But even if you are, there are safety rules you absolutely need to follow. In the next section, I'm going to walk you through those rules step by step, because when used right, this little tool can change your life. When used wrong, it can land you in a hospital bed with regrets you didn't deserve. So don't skip the next part. It's that important. Safety first. What every man needs to know. All right, let's get something straight. No tool, no matter how promising, is worth using if you don't use it safely. I say that not to scare you, but because I've seen what happens when men skip the fine print. Years ago, back when I was still a resident, a man in his late 60s came into the ER with tears in his eyes and a bottle cap stuck at the base of his penis. That's right, a plastic soda ring. He thought it was clever, cheap, harmless, but by the time he came in, things were so swollen we had to call the fire department to cut it off. That's not a metaphor. Now look, I tell you that story not to embarrass him, but to protect you. If you're gonna try a penis ring, here's rule number 1. Use the real thing. Not a shoelace, not a hardware store O-ring, not something you found in the junk drawer next to old batteries. Use a medical-grade silicone ring designed for the job, period. Rule number 2, set a timer. I don't care how good things feel in the moment, this isn't a leave it and see what happens kind of tool. 30 minutes, that's it. After that, it comes off. Leave it on too long and you risk nerve damage, bruising, and worse, tissue loss. If your penis starts turning pale, blue, or numb, stop everything and remove the ring. That's your body waving a red flag. Don't ignore it. Rule number 3, use the right lube and use it every time. Water-based lubricant helps you slide the ring on and off without tugging or damaging the skin. Just one note, if your ring is made of silicone, skip the silicone-based lube. It can break the material down over time. Stick to water-based, always. And hey, I know some of you are old school. You think, I've got calloused hands. I can handle a little friction. That's a fast way to end up with a conversation you don't want to have with your urologist. Be smart. Use the lube. Rule number 4, never fall asleep with it on. I get it. You're relaxed, maybe had a glass of wine, the evening went well. But you cannot risk forgetting that thing's still on. Set an alarm on your phone. Make it part of your routine, like brushing your teeth. And listen, if this is all new to you, ask questions. There are solid, safe how-to guides from trusted sources online. And yes, your doctor is there for this too. If you don't know how to put it on or how tight is too tight, say something. Real strength is not pretending you've got it all figured out. I want you to feel proud, not panicked. I want you to rediscover connection, not end up in the emergency room with swelling and regret. Because used the right way, this little ring can be life-giving. It can rebuild closeness, restore dignity, and let you finally exhale, knowing your body is back on your side. Now, we've covered the how, the who, and the what if, but let's talk about the why. Why do so many men from all walks of life end up loving this tiny, simple tool? Let's explore that next. Why some men love it? The real advantages. You know what I love most about this job? It's not the textbooks, it's not the lab coats. It's the moment a man walks back into my office, a little straighter, with that look in his eyes that says, "Doc, I feel like myself again." And half the time, that shift didn't come from some miracle pill. It came from something as simple as a soft silicone ring. See, for a lot of men, the penis ring isn't just a device, it's a relief. A sigh of, finally, something that actually works without turning me into a walking pharmacy. Let's be real here. Most of us over 60, we've got enough pills to start a side hustle. Blood pressure, cholesterol, diabetes, joint pain, you name it. The idea of adding another pill just for intimacy, it's exhausting. That's why this little ring hits different. No meds, no prescriptions, no insurance battles. Just a tool you use when you want to. No side effects, no red face, no foggy head. And here's the kicker. It's non-invasive. No needles, no surgery, no awkward procedures. You just slip it on, give your body a boost, and you're back in the game. I've had guys tell me, "Doc, I thought I was out, but this gave me my edge back." And it's affordable. Most rings cost less than dinner at a halfway decent steakhouse. And it lasts. Some men use it for months, even years, without needing a replacement. No recurring prescriptions, no pharmacy lines, just yours. Some newer models even come with smart features. One of my patients, mid-60s, tech-savvy guy, used an app-connected ring to track his progress. "Doc, I'm setting personal records now," he joked. We both laughed, but inside, he was proud, and he had every right to be. But let's go deeper. The best part, the part that really matters, it's not the firmer erection. It's the confidence, the connection. That quiet moment afterward when a man lies there beside his partner and thinks, "Yeah, I showed up." I had a couple, married 43 years, come in together. The husband was shy, nervous, but his wife, she reached over, held his hand, and said, "We just want to feel close again. That's all." They tried the ring, and a few weeks later, he said, "It wasn't just the sex, Doc. It was lying there afterward, not feeling ashamed, not worried I disappointed her. I felt like me again." That's why I do this. You don't need to be in a relationship to benefit either. A lot of older men use penis rings for solo intimacy, to stay in touch with their body, to keep blood flow strong, to feel like they're still in the driver's seat. But hey, I'm not gonna sugarcoat it. These rings aren't perfect, and they're not for everyone. In fact, some guys find them uncomfortable or just plain awkward. So in the next part, let's talk honestly about the downsides, the stuff no one wants to mention, but you need to hear. Because if you're gonna try this, you deserve the full picture. The downsides, what to watch out for. All right, we've talked about the upside. Now let's talk about the rest of the story. Because look, I'm a doctor, not a salesman. And no matter how useful a tool is, if you don't know its downsides, you're walking in blind. Penis rings? They're great for some guys, life-changing even. But for others, they're more trouble than they're worth. First off, discomfort. A lot of men, especially the first time, pick a ring that's too tight. Why? Because we're men. We think tighter means stronger. But when it comes to blood flow down there, too tight means numb, cold, purple, and not in a good way. I've had patients show up saying, "It hurt, but I powered through it." No, sir, this ain't arm day at the gym. If it hurts, stop. Second issue, sizing. Rings aren't one size fits all. Some slip off. Others feel like they're choking your manhood. And if you buy one online without guidance, you might waste money and confidence in one night. You might need to try 2, maybe 3, before you find the right one. That doesn't mean it's a bad tool. It means you're human. Third, and this one surprises some guys, it can mess with your ejaculation. For some, it delays things. For others, it blocks the release enough to feel off. It's not dangerous, but it can feel different. Now, if you're someone who struggles with finishing too quickly, that delay can be a blessing. But if you're trying to conceive, or if climax is a big part of what you look forward to, just know that a ring might shift the rhythm. Fourth, let's be real, it can kill the spontaneity. The moment gets hot and heavy, but then you have to pause, find the ring, apply the lube, get it on just right. It's like trying to light a fire and realizing you gotta read the manual first. Some men get used to that rhythm. Others say it breaks the mood. And both reactions are valid. It just depends on how you and your partner roll. And finally, let's talk about the elephant in the room. The shame. Some men feel embarrassed needing help down there. They see it as defeat, like they're giving up their man card. I've had guys say, "Doc, I should be able to do this on my own." And I look at them and say, "So should your knees, but you still use that cane, don't you?" Using a tool doesn't make you weak. It makes you smart. Hell, it makes you brave, because you're choosing connection over pride. And that's not weakness, that's wisdom. Bottom line, penis rings aren't magic. They don't fix everything. They don't work for everyone. But if you go in with realistic expectations, some patience, and the right info, they might just surprise you. Now, you've stuck with me through the science, the safety, the stories, and even the not-so-glamorous parts. In this last section, I want to leave you with something real, something personal. The story of a man who found hope in a place he never expected. And if you've been wondering whether this tool is for you, stick around. You need to hear this. Conclusion. Is a penis ring the secret to stronger, longer-lasting erections? So, after everything we've talked through, is a penis ring the magic answer to better, longer-lasting erections? I'll tell you the truth. No, it's not magic. But for the right man, used the right way, it just might be the missing piece. Over the years, I've sat across from thousands of men. Some walked in frustrated, some walked in ashamed. All of them had one thing in common. They wanted to feel like themselves again. And sometimes that started with something as small and as powerful as a simple ring. It's not about pretending you're 25 again. It's about showing up, feeling present, feeling whole, and having the courage to say, "I'm still in this game." We've covered it all: what a penis ring is, how it works, who it helps, when it hurts, and what to expect. You now know more than most men ever get the chance to hear. So here's my honest advice. If you still want closeness, if you still care about connection, if you're still willing to learn a little, try a little, and respect your body, then yes, it's worth a conversation. With your partner, with your doctor, with yourself. You're not broken, you're not washed up, and it's not too late. One of my patients, 74 years old, remarried after losing his wife, looked me in the eye and said, "Doc, I just want to be able to hold her afterward and not feel like I let her down." We tried the ring. A few weeks later, he came back, tears in his eyes, not from failure, but from relief. He said, "It wasn't about the sex. It was about laying there, feeling proud again." If that hits you in the chest the way it hit me, then maybe it's time. And hey, if this talk meant something to you today, let me know. Drop a yes in the comments, or tell me your story. You'd be surprised how many men are listening, quietly, just like you. Hit that subscribe button if you want more of this kind of talk. Real, respectful, and no BS. Tap the bell if you're ready to learn more tools to stay strong, sharp, and healthy as hell. You deserve intimacy. You deserve confidence. You deserve to feel like you again. I'm Dr. Jonathan Prescott, and I'll see you in the next one.